more stories, including sports and entertainment, coming up over the next 1 hour.
Now, let's tell you this moving, but also a sad story about 10-year-old Ronnie Gato, who was playing with his friends in December last year when he suddenly fell and broke his neck, paralyzing him in the process. Medical doctors in Ghana apparently lack equipment required to conduct surgery on him after diagnosis. However, a team of medical experts from India who are in Ghana to conduct surgery on the conjoined twins have also stepped in. Portia Gabo witnessed the rare and also life-changing surgery and brings us a story.
I first met Ronnie Gato at the Greater Accra Regional Hospital. The once lively boy had been left paralyzed after the fall. He's unable to walk and either has to be in a wheelchair or lie down. The equipment required to conduct the surgery was not available at the Greater Accra Regional Hospital, and his mother did not have the estimated $25,000 to fly outside Ghana to save her son's life.
I
returned home from work when I was told my son had a fall while playing. His hands twisted backwards. We brought him to the hospital and doctors told us he needed to undergo an urgent surgery.
Barely 10. He's not able to speak at all.
But hope found Ronnie. Dr. Deepak Gupta was in Ghana to join a team of healthcare professionals to conduct surgery on the conjoined twins. He, together with a team of local and international health professionals, have offered to bring in the equipment from India to conduct the surgery at no cost to make Ronnie move once again.
A young boy, budding young boy, had an accident, and the complications of the accident is something that we cannot even talk about. But when our colleague spoke to our friends from India, they quickly came down. At no cost of this, at no cost to the patient, no cost to this hospital.
When he showed me this case of 10-year-old boy, Robin, I requested my friends, Mr. Abhay, who is the CEO of an implant company, if he can provide implants at free of cost to this child, and he agreed. I would be very happy if in this country all neurosurgical operations are possible, because the people here have got the knowledge, they have got the skills. It's just some amount of knowledge transfer which needs to happen between different countries, and which will uplift the services here in this country.
It's the day of surgery. As Ronnie is wheeled away for the 5-hour life-changing surgery, his mother is anxious and clings to prayer.
10-year-old Ronnie Gato was playing with his friends when he suddenly fell down, leaving him paralyzed. Now, through a collaboration with a team of medical doctors from India and Ghana, they are trying so hard to improve his quality of life.
This is one of the complex and complicated surgeries in the spine. You need special equipment, special tools to be able to execute this. Now, looking at the patient's background, we realized that he couldn't afford. And it's not all the time we have to come out to request for funds or to send patients out of Ghana. We do believe that if we want to progress, we need to start doing this kind of surgeries right here. If we get subsequent cases, we don't need to send them nowhere. And we see these cases very frequently because of road traffic accidents and other falls. And this is just 10-year-old child who can be the next president of the country, can be the next minister, or can be the next person to put food on our table.
The surgeon. 2, 3.
Combined team of local and international healthcare professionals, including neurosurgeons, nurses, radiographers, and anesthesiologists, are putting in their best for Ronnie Gato.
The patient throughout this surgery and securing the airway should not move. Now, in order to achieve that, we need to use special pieces of equipment like fiber optic or a video laryngoscope, all the meantime maintaining the head immobilized. But that has been successfully done.
Imaging is very, very essential, and fortunately in the Greater Accra Regional Hospital we have the systems which make it a very holistic form of treatment, because you can easily come in for your imaging and then see the neurosurgeons for your surgery.
For Ronnie's mother, she's hopeful he will regain his life back after surgery.
After this surgery, the quality of life will improve depending on his exposure to physiotherapy, because the central nervous system does not have the capacity to regenerate.
The condition is not that good, but we are praying that with little effort by the surgical team, it must be 50-50.
3 weeks after the surgery, I'm back here at the Greater Accra Regional Hospital to check on Ronnie's progress.
Ronnie, please, let's lift the right hand now. Okay, I will lift the left hand. Okay, good. Things which we couldn't do before. Now let's lift both hands up. Okay, and hold it a little. Sustained. Okay, great.
Yes, actually superseded all our expectations, because right before surgery he was even unable to move both upper limbs and lower limbs. But as we can see from the examination currently, he moves them very well.
Will he be able to walk again?
Yes, with active physiotherapy, there's a very, very good chance that he'll be able to walk. He wasn't able to swallow food easily, but after the surgery and these couple of weeks, we have seen a lot of improvement pertaining this.
Ronnie, how are you feeling after surgery?
I'm fine.
What are you able to do now?
I can lift my hands and my legs. I want to say thank you to the doctors and everyone who helped me.
The team of healthcare professionals from India were later honored for their humanitarian work by management of the Greater Accra Regional Hospital. TV3 will follow up on Ronnie's progress and update viewers. For Shagabo TV3 News, Greater Accra Regional Hospital, Accra.